We are absolutely thrilled to be here today. And we actually feel that it's quite awesome that we have such a small group because we feel that we can really get to know each other here. You can interact with us, get to know us, and we can get to know you. And we're also hoping that you will connect with each other. So, you know, we're hoping for sort of a real a discussion in this session. And note that you each have a book in front of you, and in the book, the first three tabs are the PowerPoint for the presentation. So if you choose to take a look at that as we're going through, that is available to you, along with some other resources in the back. But the first three tabs will actually be the flow of the presentation today. I was very pleased when Richard asked me to facilitate the panel discussion because M&A is a topic that is very near and dear to me. As a CEO, I've been on both sides many times. So, you know, I have been an acquirer many times, and on other occasions I've been the target company for the one being acquired. So I, you know, kind of experienced the whole thing. And what I've learned is that there are some terrific short and long-term benefits. You know, it's that old, so I've been able to see it happen, and I've been able to see how it's gone over a period of years. So there's been great benefits in every instance that I'm aware of the ones that I've been involved in, where there's been great benefits for the acquired and for the acquirer. Of course, you also, you know, will see improved programs, and you'll see a tremendous opportunity for staff and for the clients. So it's been almost 20 years since I was the executive vice president of Shepherd Pratt Hospital System. Richard mentioned that, and at that time, this was 20 years ago, I led a very aggressive strategic growth plan that resulted in a wide range of business combinations for Shepherd Pratt. It was a hospital system in Maryland. And most of these were acquisitions. At that time, I was not aware of any nonprofits. This was about 20 years ago. I was not aware of any nonprofits in our business with such a clear and aggressive growth strategy. So through that experience, again, I saw firsthand some immediate impact, and that was 20 years ago. I saw some terrific impact. And I've had the benefit over the last 20 years of being able to watch what happened to those organizations. And again, you know, I've seen some just great benefit that they have gotten over the last 20 years, especially with some of the other changes in our environment today. They're much better positioned than they would have been had they not done that at the time. So it really is pretty remarkable to be part of that and to see what really can happen. So now we'll fast forward to now, and M&A is way more commonplace, as you know. Many of you have been involved with it. In my new role as an executive search consultant, as Richard mentioned, I become really aware of now on another side and able to sort of see what boards and executives are doing now in terms of their leadership. And there's some dramatic shifts, real dramatic shifts in the last 20 years over the skill sets that are required of the executives in behavioral health, human services, substance abuse. Every nonprofit that I work with to fill an executive position has a requirement that their executive candidates have experience in M&A. I know there are exceptions to that, but the ones that I happen to be working with, that's kind of a big deal. And then when they get into the interviews, what we're finding is that that topic of M&A is front and center in those interviews. It's also telling, and Rick and I were talking about this a little earlier, that when organizations are hiring CIOs, COOs, or CEOs, they are expressing a very strong preference for either for us to look for people in the for-profit area, or actually more commonly, they're saying, help us to find somebody in healthcare, being hospitals. You know, help us to find executives in these top positions who are working in healthcare. So I have dedicated my career, I'm very passionate about this. Behavioral health and human services has been my career passion. I could also talk about the animal welfare in here, but I won't here. That's the other passion. And so although there are plenty of exceptions, I know, I have really come to believe very strongly that our organizations, our industry would be much stronger and healthier and much more sustainable if we would increase the pace of these business combinations. Now, this is my opinion, because having gone through my own experiences, this is a perspective that I've gained. And this is the reason I wanted to be here. I was very excited to be here for this discussion and participate in what will be, I hope, as we're all discussing this, a very important dialogue. So now back to here to us in this room today. The topic of M&A is particularly challenging here in this room, although I think it might be even more interesting because each of you has chosen to be here for different reasons. And I've had a chance to walk around and talk to a lot of people. I knew something about your organizations anyway. And you really have a lot of different experiences and levels of experience in this. So some of you are considering, some of you have a lot of experience in M&A. Some of you are considering a merger or acquisition, but you'd really like to improve your skills. You want to learn a little more about how to really be even more successful as you're doing this. And there are others of you who have no experience and are not necessarily planning at all to engage in an acquisition at all. But you see this as an educational opportunity, which I think is really great for those of you here who are here for that reason, because you want to broaden your understanding in what really has become, as I've mentioned, a more and more common business strategy for nonprofits. So really important that people understand what this is. In light of this, my colleagues here, my wonderful colleagues, have chosen to present the topic of M&A using their own organizations as a sort of case study. So that's the format that we're going to be using here today. And they're going to be telling you their stories. In this way, we are hoping that your interest in this topic and knowing your very varied interest in this topic will intersect at different points of discussion that are really meaningful for you. So we'll be talking about telling stories, and we're hoping that that will be a meaningful way to convey ways that this can be done. There will be a focus here on the unique, and this is interesting, and I think it's something that makes this session very unique and maybe more high level than some that you might have sat through. There will be a focus here on the unique financial advantages gained through M&A for nonprofits specifically. And surprisingly, I have found that some of the most remarkable benefits of M&A are not commonly known by your nonprofit executive colleagues. There are loads of exceptions, but in general, people are not aware of a lot of this. So, for example, as nonprofits, we almost always realize often realize a significant financial gain on the closing date of a transaction that does not occur in commercial transactions. So you'll learn what is the difference, if there's a nonprofit combination versus a commercial combination. And you'll get real clear here in this session about that. In sharing their stories, our speakers are going to illuminate on a range of financial opportunities and strategies that they have seen what they have gained through mergers and acquisitions. So that's going to be a nice focus here for you. I guarantee that you're going to leave this session. You really are going to leave this session knowing more about the mechanics of M&A than most of your executive colleagues, because we're going to really be able to get in some depth with the time that Richard has given us for this session. And again, I hope we can also learn from each other. You're going to be sharing your stories and we can hear from you. So with this wonderful small group here today, we also want the session to be, as I mentioned, very interactive. And again, we want you to share your stories, and we feel that in some ways what you have to say is going to be just as meaningful, if not more, to other people sitting in the room. So we really hope there's going to be sharing. Please let us know if at any time you need further clarification. This is a really important point. Some of what we will be presenting is going to be highly technical. And just remember that if you are sitting there thinking, wait, I didn't quite get that, or that didn't quite make 100% sense, just remember that there are probably other people in this room who are thinking the same thing. So please ask questions as you see where you might want some more clarification if that were to happen. So I will now introduce our distinguished speakers. I'll introduce all three of them at once before we begin, because I'm thinking that there could be a lot of interaction that occurs before we get to the second and third one, so I want to make sure that you're all introduced. So first, Rick. And having walked around this room and met many of you, I've learned that Rick actually is very connected to a number of you. I heard his name from you guys a number of times, so it's really great that you're already benefiting from Rick's experience. So after graduating from Cathedral Prep School and Gannon University, Rick has spent the last 35 years as a healthcare administrator and consultant. Prior to leading the administrative team at St. Vincent Health Center in Erie, Pennsylvania in 1991, he worked extensively in the areas of medical staff development, behavioral health, and health informatics and finance. In 1991, he founded Deerfield Behavioral Health, where he remained as the CEO for 16 years, specializing in behavioral health information systems practice, public sector counseling and finance. In 2007, he accepted the position of President and Chief Executive Officer of Beacon Light Behavioral Health Systems in Bradford, Pennsylvania. With close to 600 employees in 24 locations in 9 counties, Beacon Light has shown rapid growth over the past several years. In 2014, Rick founded the Journey Health System, an affiliated group of providers encompassing a large portion of Pennsylvania. Journey Health today employs close to 1,400 individuals with gross annual budgets approaching $86 million. In addition to his current duties, Rick has served as a member of the board of directors of CNB Financial Corporation since 2010. He currently serves as chairman of the Executive Compensation Committee, along with serving on several other bank committees. Rick participates in governance of many community organizations, including the Beacon Health System in Erie, Pennsylvania, the Bradford Area Business Alliance, University of Pittsburgh at Belford, and most recently as president of the Conewango Club of Warren. So welcome, Rick. This is Rick. And next, I will introduce, and these are not in any particular order, I'm going to introduce Kevin B.
See, I beat you.
Kevin. Kevin is the president of Angler West Consultants, an advisory firm focused exclusively on mergers and acquisitions of human services organizations. And I know a number of you in here know Kevin as well. Clients of the firm have included public, private, and nonprofit corporations. It was founded in 1996. Angler West has been involved in more transactions involving nonprofit human services organizations than any other intermediary over the past 2 decades. Prior to founding Angler West, Kevin had more than 25 years of experience serving as a senior executive of various nonprofit health and human services organizations. This experience included positions with providers of behavioral health care, substance abuse treatment, and developmental disabilities programs. Kevin has published articles on topics including business combinations, financial restructuring, valuation, and governance of nonprofit organizations, and has presented at conferences on these and other topics. Welcome, Kevin.
Thank you.
And our third presenter is Ryan Smith. And Ryan, here. Ryan founded Inperium in January of 2016. Inperium is the parent company of nonprofit agencies that provide person-centric mental health, intellectual disability, co-occurring disorders, health-related supports, and other related services. Imperium was established to support and oversee affiliated companies to ensure quality services and continuity of care and efficient use of public funding and resources. In his present position as president of Imperium of Family Services, Ryan continues his efforts to expand upon his proven track record of developing, revitalizing, and growing business enterprises. Ryan continues to guide and direct his other enterprises through substantial change management, with strong and effective leadership and an ongoing commitment to providing quality outcomes to all stakeholder representatives. Ryan's numerous and varied experiences have resulted in significant successes for the communities served by Imperium's family of services, as well as for those employed by these entities. During Ryan's tenure as CEO, revenue has grown from $4.5 million in 2000 to more than $65 million in 2018. That's we need to find out how this happens. Since March of 2000, Ryan has also served as the president and CEO of Supporting Concepts for Families, which in 2016 came under the umbrella of Imperium. Through introduction of a focused strategic planning process, Ryan has also ensured that these business processes resulted in an equilibrium between the company mission and vision, which reflect person-focused values. Ryan has long credited these achievements to the experiences he gained when he had the privilege of beginning his tenure with Supportive Concepts for Families as a program coordinator in November of 1993, serving as the director of programs for more than 2 years, and then as chief operating officer prior to his appointment as CEO. Perhaps most significantly, Ryan has provided oversight of Inperium's family of services growth, which has resulted in the expansion of a robust array of quality services to customers, financial diversity and strength, and affiliations that leverage resources to achieve quality results. Welcome, Ryan.
Thank you.
Okay, I will now turn this over to Rick.
Well, thank you. I guess I'm one of those kids in 6th grade couldn't sit still in class. I still can't. So excuse me if I pace a little bit while I'm talking. That's kind of my MO. And please feel free to interrupt with questions or thoughts as we go forward, okay? We're here today to talk to you a little bit about our experience. What led us to the decisions we've made over the last 3.5 years, and where do we think it's going to lead us next in life? And really spend some time doing those things today. If I don't get your attention, you can either wave or throw chocolates. I do like chocolates, so you can throw those also. If you have trouble with attention there. We'll go ahead and how do we move forward? Okay, someone's doing it.
Here you go. I'll give it to you.
Okay, thanks.
That way then you can be the master. There you go.
But it seems like a pretty hard work.
It's just the arrow over button.
That was kind of figured through my CV, but I spent a lot of time on boards. I spent a lot of time with behavioral health consulting practices, companies, over 30 years in healthcare, executive generally. And right now, the most interesting has been the bank board. I've been on the bank board since 2010 and have really chaired the mergers and acquisitions process there. And there is a lot of differences between doing nonprofit and for-profit work. It really is a whole new different arena. And we're going to talk more about that as we talk about what the world looks like today and why we've chosen to go down the path we have, which I think for all three of us you'll find to be somewhat different in the way that we put these presentations together. To really figure out where we were, we had to go back and look at where we came from. Nonprofits invariably reflect the time they were created. We were designed as that buffer between government and the individual. Right? At the end of the day, we worked as extensions of government. County government in Pennsylvania most of the time, but basically government funded, county managed, provider took care of the consumer. And at the end of the day, we got paid based upon our costs and all was pretty good. If we overspent, someone called us in and slapped our wrist at the end of the month, at the end of the fiscal year, and that was okay, and we got our money and we walked away anyway. So that pretty much worked okay. We grew up in a time in the 80s of catchment areas where the number of patients you could take from a certain geographic range were restricted in Pennsylvania. Are we still having caps on retained earnings? That pretty much today, even though we're fee for service, counties would still require an earnings cap. They won't do an engagement unless there's a 3% earnings cap under the old regulations. We're still facing some of that in today's world. How many of you still being funded by the county? Program funded? How much of it is the same as it was 5 years ago? More. Okay, it's more. Okay. We're at a point where we're seeing declining funding streams from the traditional methods. And I think we have to come to grips with the fact that the business models that we're using to deliver care are changing dramatically. 95 came along. Our good old friend Charlie Curry calls and says, wait a minute, I've got this new RFP going out for managed care carve-out for behavioral health care. Can you take a look at it and tell me what you think? In the world that we began to work in changed dramatically. The rules of government constraint continue to lessen. We learned CPT codes, revenue cycle management, utilization review, and service authorization for the very first time. All those things hospitals did for years, we now had to learn how to do. We need to bring in the talent pools to know how to do them. Today, our work processes are closer to the medical systems than the social rehab model that we all came out of. And I think that that's really critical to the way we work today. And actually, Daniel and I were talking about this before we started, and that is I recruit out of hospitals. When I'm looking for executives, I go to the healthcare systems today. Okay? Why? Because the people have the experience doing all those things above them. We don't really have comprehensive experience as to how to do those in an organization. So there are consequences to changes. There is to everything, both good and bad, in our experience. We're no longer geographically constrained, as in prior decades. We're not held by a county. That's often a very positive thing because we can actually lead several counties to pursue business opportunities that they're presented to us. We no longer access attention of government necessarily, but there's a bad to that, and that's government's no longer going to guarantee our outcome. If we suffer operating losses, we suffer operating losses. And I think that's a change for a lot of our people to adapt to over the last decade and a half. Therefore, the skill sets we need to manage have changed dramatically. The days when that 40-year social worker, who was a great social worker who cares about our consumers from our nonprofit agency, is probably heading the way of the nuns running Catholic healthcare systems. I worked in a lot of those too, before they went away over the course of the years as a consultant. And yet, our ability to grow remains constricted, basically because our prior business model no longer works. A lot of what we used to do doesn't really function very well anymore. Yet we keep doing it. So where does this leave us? We're now a healthcare business. And we're beset by all those demands that healthcare businesses have in general. Yet the skills necessary to operate complex financial and healthcare business structure has been lacking a little bit. And are we really up as an industry to what we have to do next? And I really question that sometimes. Do we really have the strength in people, knowledge base, and plans to people to move this thing forward the way we need it to be moved? The context. Healthcare costs are rising at an unsustainable rate. All of us that are large employers feel that every single year. You know what can destroy my budget this year? 5 premature baby claims. Well, it takes us 5, and pretty much the budget shot for the year. Okay? Do anything you want to do. At the end of the day, you can't fix those caps. So that's a thing we live. We live with affordable executive talent problems. The people that are out there are good, expensive. It costs a lot of money. And that's a real challenge for us as an industry. Limited opportunity for program growth as a means to increase revenue. Some of our areas are so full of providers, particularly our larger urban markets, and it's tough to find those new opportunities that allow revenue to grow. And when there are new opportunities, there's often 20 people applying for it. Okay? So it's really competitive what's out there at this point in time. There's greater demand and expense around self-auditing, the latest IT system, best practice, outcome tools, and decision support tools. We just put $1.2 million into new software for general ledger, accounting, and human resources. Okay? And that's not uncommon today. We're seeing the quality products costing even more than we've seen them before. Value-based payments require access to greater liquidity. I'm going to spend a lot of time talking about liquidity today. And our ability to survive is going to be our ability to access money. Okay? And there's a lot of reasons that we're challenged in this to do that. And I'll spend some more time with the end doing that. The result, all aforementioned cost increases while our revenues are relatively flat. Value-based payments will dramatically increase our needs for cash. We are already seeing them dramatically increase our needs for cash as an organization. And the mission of our agencies will become tenuous if we don't find a way to solve those problems going forward. Any disagreements? Arguments? Okay, let's go to the bar office.
Where's the good news?
Where did we get there? Here's what we looked at, and we really spent some time strategically talking about all these options. Do we remain a standalone organization at 22 million and 600 people? Is that possible for us? We remain a standalone organization, but purchase administrative services from another organization, the ASO model, right? Where we basically will buy those things that we can't afford to employ or have on our own. We could remain standalone and actually begin to sell administrative services to other organizations using that same ASO model, but as the one selling at that point in time. Can you hear okay? Okay, thank you. Sorry, I made that more complex. We can form joint ventures with other organizations. And those of you who've done joint venture models where more than 2 agencies actually start a new product or a new service, they do work. It gets a little difficult sometimes in certain areas, but they do function well and there are benefits to them. Acquire smaller organizations via merger. Can we take on smaller companies and kind of bring them into what we're doing and kind of eliminate the corporate umbrella and just keep moving on by growth that way? Become a larger organization via mergers, and form a joint affiliation model. And we chose the latter. And I'll show you why when we get to the next slide, which is really what drives anything that we do in mergers and acquisitions, which is basically our values. we have to go back and say, you know, what's important to us? If we're going to start bringing agencies together, what matters to them? What do they want to keep? While forming a parent support corporation, local boards for all of our agencies remain fully intact and control of the agencies in ways that meets community needs. No one wants to be owned. It's not a big desire. No one wants to be taken over. We all have districts. We came out of the Jewish Women's Foundation. We came out of the Catholic Church. We came out of the Presbyterian Ministries. We came out of all these places. Those are our history. We own that. And what we really find working with agencies is the boards themselves don't want to surrender that. That's why they're there. That's why we have good people to serve on boards. We don't want people to lose that. And that was a real thing we heard consistently from talk to agencies, was trying to find a way to keep their local identity. We want our provider system to always belong to, in every possible way, the community they serve. We don't ever belong to us. And if you look at their literature for all those agencies, you'll see a little footnote on the back, an affiliate of, okay? And that's all the advertising we ever want to do. The agency will always be first and foremost part of the county they serve. By the way, that's critical for fundraising. You're going to go out and raise funds in the community you're in. The minute they think you're owned by something bigger, your fundraising will just simply evaporate. And it happens consistently. Achieving agency board participation and governance of the support corporation. We built the parent company, and then we said, look, when you come on board, your chairman of the board actually sits as part of the parent board company. And by the way, sits on my compensation committee. So at the end of the day, they keep me honest. It's probably a good way to do that at this point. It works pretty well. And key administrative tasks were all rolled up in the support corporation. Sharing overhead, increasing talent, increasing more dollars for direct care services to consumers. We have one primary goal in this. We want to see 90 cents in every dollar that comes into the agencies that we work with go directly to frontline care. We want the overhead under 10%. We're not there yet. We dropped it about 3, and we figured that our target is about 120 million at the point that we're well under 10%, 9.2, 9.3. If you're going to raise money in the community that you serve, and it's important that you do, it's really critical that you go to them and say, look, why do people struggle with the nonprofits today? With 16, 20, 25% overhead, okay? It's really a great story when you go out and say, look, 90 cents a dollar you give me goes directly to the consumers we're trying to serve. And it makes it really, really much more effective when you're out there trying to raise money in the market. So who are we? We're a 509A Type 3 nonprofit. We have no ability to deliver services to anyone. By IRS, it's mission singular to support the 501c3s that we support, encompassing clinical, fiscal, and political support. The board of directors is comprised of representative board members from the other affiliated organizations, and a few outside community board members and professional board members at the same time. Here's what we do. We coordinate a variety of administrative functions within and between the affiliates. Administration, fiscal, human resources, corporate compliance, information technology, clinical practice consultation. We have a full ERM, Enterprise Risk Management Department, that functions for all the agencies. And where appropriate, bulk purchasing of goods and services, including healthcare, which has been a major upfront benefit to us in the first several years of doing this. It also allows us, interestingly enough, to be able to hire at a different level our talent pool. Our current chief financial officer isn't the CFO. Every agency doesn't have their own CFO. We have one CFO for 7 or 8 agencies, and he gets paid a lot better, of course. And he actually was a national tax partner for BKD and is a CPA out of the public consulting firms. So we actually are able to hire a different skill level. We just hired the director of physician services from one of the big hospital organizations. So we started this next month, and in physician alignment, strategic development from that standpoint. So you're able to hire at a different skill level because you're sharing the cost of those skill sets. Today we're up to 14,000 individuals served annually. That's kind of our geography in Pennsylvania today. We employ a little over 1,500. That's going to 1,700 with the new affiliation coming on in October. Provide services in 21 Pennsylvania counties, and we're up to about 88 million. Our next benchmark is about 120, is what we're looking at this point, to really get our cost structure to where we want it to be going forward. So today we have several organizations: the Beacon Light Health System, Dickinson Center, Beacon Light Adult Residential Services, Locust Management Solutions, Forest Warren Mental Wellness, New Opportunities Unlimited, We have the professional associates and Stairways Behavioral Health and Erie are all current affiliates at this point in time. We'll be announcing a new one coming up as soon as the director of agreement is signed this fall. Here's all the things we face when we talk about affiliations. These are the greatest myths of all. There'll be massive job cuts. The answer is no. Attrition works. The larger size you have scalability-wise, the easier it is to kind of find that scale over time. There's nothing economically driving the need for massive job changes today in the affiliations that we're doing. And actually we make it a point to do that because it causes tremendous morale problems in the agency if you start down that path. Number two, we'll lose our identity. That's a big risk. And we have to work really hard in the way we structure to make sure that we don't. That our identity still is that community belonging sense that we're trying to create. Let's figure out all the structural details first. It's probably one of the biggest problems that you have to go with. Or, by the way, the better one, let's make sure our cultures are all the same. Okay? We could talk about that till about 2035 and we won't get there. Okay? But one of my best experiences in trying to do work with organizations both as a consultant and as kind of an operative of one of these structures today is support the local culture, don't try to change it. Now, yes, there'll be certain things that will change, there's no question about that. But to say we're all going to operate from the same culture could be years of fighting that's never going to get you anywhere. We have agencies that are big enough and broad enough statewide, they have different cultures and different pockets of the agency. Because it's driven by so many factors locally, okay? So rather than fighting it, trying to find ways to support it has been really a good strategy for us. It makes a lot of those initial wishes go away that you see in that process. And lastly, only failing organizations affiliate. Well, that's probably the last time you want to affiliate. And the ones we won't look to work with because at the end of the day, we're not rescuers. That's not our job. We're not there to rescue organizations. These are things I usually ask people to consider if they're thinking about affiliating.
Can I ask you a question about the failing organizations? You say you're not a rescuer, but do you have a plan in place to, through due diligence, to look at an organization that may be losing money but has a solid business model?
Absolutely, yes.
So in other words, you're not rescuing someone that you know is going to continue to lose money if they don't change their model.
That's right. And you know, what really is then helping them change their model, right? At the end of the day, we've got a really good team in helping figure out how to change the business model. I don't think anybody making millions in outpatient today, you know, getting rich doing outpatient services, well, everyone's losing money in certain business lines. That's just part of the industry right now. Right. When I say that the business model is broken, if you can figure out a way to make money in outpatient today, we want to see it because, quite frankly, the business model is broken. It is, okay? It's not going to work going forward. What we don't believe is that anybody really wants to fix it yet because we don't think the state wants 300 providers in outpatient anymore. They want 60, okay? So I don't think the political willpower is there to repair the problem just at this point in time in this particular state. I say in other states, and my colleagues there work with also. So, you know, we look at that and say, the first thing about consideration I have people look at is, do you have a reliable succession plan? Remember that changing talent pool I said we're going to be facing? Is there someone coming up, if you recruit the right people that can take over the organization going forward and carry it through what's going to happen next? We'll talk in a minute about what's going to happen next. Is there growth in your balance sheet over the last 5 years? This is a real simple analysis. It doesn't take a finance person to do. Take your cash on your balance sheet from investments and operations and divide it by your average monthly expenses for the last 5 years consistently and see what direction it's going in. If it's staying flat, you're probably okay where you are. If it's going up, you're doing great. And if it's going down, it's something to really consider about. If you follow that pattern down, where does it lead you? And I think it's really a very simple analysis to do. It gives you a picture of direction of an organization as it rolls forward. Does my agency have the talent to keep up with current demands in compliance, finance, value-based contracting, and other new business skills? Are they in your organization today? Can you create and grow those talents? Do you have the resources to do that? And do I have the correct foundation to carry my agency's mission 5 years from now? We, as nonprofits, own nothing. And I find it interesting I hear people say things like, it's my program or it's my agency. Because at the end of the day, we belong to the communities that we serve. We always have and we always will. Okay? And there's a mission to what we do or we wouldn't be here in the first place. Thinking on 50 or 100 years later. Do we have the skill sets today to carry that out? And if the answer is no, how are we going to carry it out 5 years from now? What is that going to look like? And how can I meet the future cash demands? Most nonprofits have a very strong balance sheet but lack liquidity. How did we get the strong balance sheets? Well, we bought real estate, we bought campuses, right? We bought buildings, and we paid them off with state and county money, fee-for-service money. So you look at our balance sheets, and we look really good on the debt-to-equity ratio side. We've got a lot of those properties for a lot of years, but how much cash can you come up from? And the answer is that's going to be our biggest challenge going forward is the liquidity of these corporations as we find ways to do it. In Pennsylvania, by 2020, our provider payments will be value-based in some form with a up to 20% by 2020. Okay? Now, take 20% of your overall revenue stream and hold it for 6 months. And tell me what happens to your cash. We assume already as a group that's going to cost us about $17 million in cash flow we're going to have to manage in the course of the next 3 to 4 years. How do nonprofit organizations come up with that kind of cash? Okay? And I think that's something you really have to think about and ask yourself. Because the traditional methods by which we raise cash will prove to be inadequate. Banks will lend to us, but they'll lend to us up to our asset value. Right? And at the end of the day, if you need a little more than that, you need your credit lines expanded, they don't understand our business model, so they don't get it. If we try to show it to them, they figure out why it's broken pretty quickly. So that's going to be a real challenge for us. Okay? You can't fundraise enough. You may have huge endowments. If you do, you're lucky. If you have that extra 50, 60, 70 million sitting in the bank somewhere, growing in the marketplace, that's great. Okay? But for most of us, it's going to be a real challenge figuring out how to cash flow our agencies going forward at this point. And we're going to really have to start looking at public-private models to look at how to create cash. Right now, we are actually in the process of working with an investment banking group out of Toledo to create a healthcare REIT, a specialized REIT for human services. It's a real estate investment trust, where in fact, it's kind of a unique model. If you have a building worth $4 million and a part of our Toledo group, you sell your real estate to the real estate investment trust, right? So what do you bring in? It's worth $4 million, you bring in $4 million. But what's its value in the balance sheet? Well, it's probably depreciated down to the fact that it's worth $1 million. And by the way, you may have no debt on it. So what happens to your balance sheet when you sell that piece of real estate and take a 20-year lease back? And people are saying, well, gee, yeah, that makes sense to me, but what happens when I have to start paying rent and I have to pay a little bit more than it would cost me otherwise? The answer is, of course you do. Okay. But what's going to cost you to borrow money to support yourself in the market going forward? So my point is, we have to look for the very first time at some of the for-profit business schools and partnerships and, quite frankly, private equity opportunities as to how we're going to finance ourselves going forward. We're strong enough to do it. Our balance sheets generally will hold that kind of debt service, but we have to figure out the strategy to get things more liquid than they are today. And if we don't do that effectively, no one's going to help us in the next 5 years to be able to accomplish that task. I don't pretend to understand value-based payments. I know no one else tends to agree on them. All of our managed care companies tend to not have a good formula for what value is. So as they don't understand them, what I'm saying is the model you have today may not be the model that's going to work for you tomorrow when it comes to value-based. And I think that that technology and that process is going to evolve, and it's going to cost us as providers some money while that happens. So those are my thoughts. That's kind of where we are right now with the organization.
I have a question. So before I ask it, I'd be curious, because you talked about what you said was the AHS coordinates a variety of administrative functions for the affiliates. And first I'd be interested in knowing how, raise your hand if you've actually done some integration like that. You've acquired something and you've had to integrate it. Okay, so there are a few of you who have done that. I think it would be interesting if you would share a little bit more about how that sort of happened, this integration piece.
Well, what we do right now, for example, is when we take on a new affiliate, the employees that report to IT now report directly to the IT director, CIO, at Journey. So the report structure changes first and foremost. Okay, that's probably the number one change. If benefits are close enough to not be disrupted in the first pass through, we will actually move employees in those categories to the JHS payroll. So basically, those folks will actually become JHS employees when the affiliation is complete. Two other things will happen in the first 6 months. Number one, sometimes that's not possible and it's a benefit issue. The other thing you don't want to do is affiliate and just change your base benefits, particularly lower benefit. It's great, tremendous habit. Okay, you've got to really take your time with that and think that through. So sometimes we'll leave them there. A lot of times we try to move them as quickly as possible. When it's reasonable to do that, we move them over at that particular point. So that's probably the way it works best. And so there'll be a different reporting structure. It ends up being a little bit matrix-based. I don't like matrix management, but it is a little bit matrix-based. Those people are still on site to primarily serve the needs of the agency that they're working for prior to the affiliation and moving that forward. So, please.
Just to share quickly, we just completed the affiliation about a little over a year ago. And we did exactly what you're talking about. But the other thing we did, though, is we were very clear to set up integration teams and collaborative learning teams. And there was a big difference. And I think the staff really appreciated the difference. So all of the operational program staff were in collaborative learning teams. So that they understood we weren't integrating programs. We weren't trying to bring this outpatient in with this outpatient or this IDD residential program into this program. But we were collaborating on best practices. Then the integration teams focused on the business functions you talked about, fiscal, HR, IT, benefits. So those were to integrate. But then we just call it collaborative learning. I don't know who came up with it.
It works. It does work. And when you talk about not trying to change culture, I mean that. Going and trying to change old culture is just asking for problems. At the end of the day, the bell curve is true. Okay, which means that after you're done affiliating, 20% of the people will love you regardless of what you did today or yesterday. 20% will totally disregard anything you did yesterday. Those are the folks you give $1 million to and they say, now I got to pay taxes. Okay? We'll always have those with us. Okay? And the 60% in the middle are the ones we kind of have to win over, right? This is good for them and good for what they're trying to achieve and good for their agency. It's going to help. We have to explain to them how it's going to help them fill their mission better, how it's going to help them do their work better. Okay? And if you can't explain that, it's really tough to get these things on board. Please.
I did have a question. I know that you talked about, people always feel like there's going to be jobs lost. And you said you went to like one CFO. So I know like a lot of agencies have one CFO, their own director of development. So those positions were eliminated eventually?
They'll start eventually reporting to the system, okay? And through attrition and moving people, we generally tend to move them around to realign them over time. There's a few folks that will, these are always interesting to me. The people I think are going to shine as I go through due diligence, I think they're going to do great. Oftentimes end up getting off the bus. And there's people I think are not going to do well at all, and they end up being superstars, and I can't really ever predict that. I've never been able to. So I think, yeah, we realigned the reporting structures completely. We realigned the data structures completely. In month 3, you moved to the same accounting platform. In month 6, you moved to the same research platform. Because that gives us the ability to really work the cost structure across the board. And the rest of it falls in line. Yes?
Excuse me,
So,
before you start a question, would you, each of you, when you're about to ask a question, give your name and your organization?
my name is Jim Bobeck, and I'm the CEO of an organization by the name of Step by Step. My question to you was that when you were doing all this realignment, how did you communicate that to the rest of the staff that were there? I mean, I would personally, if I were in one of those positions that would be realigned, I would kind of have some, these are pushing me out, or really I got a demotion, is really realignment means. So
Sometimes yes. Sometimes yes. There's sometimes I wish I could tell you no, that's never the feeling. Sometimes it is. But oftentimes if you approach it right and you've got the right leadership in place in those organizations when you begin the process, people begin to try to come along. Okay. And some folks make it and some folks don't. But it's usually those top 3 or 4 positions, particularly CFO. Okay. Oftentimes your COO, believe it or not, is most threatened by it, not the chief executive officer. Okay. We've had difficulty with that position moving forward. And the marketing folks, who believe they probably know it better than everybody else does. And realigning a few of those folks has been our biggest challenge in our experience. IT is fine. They got more expertise, they got more toys to play with, they're great, no problem. Okay? Yeah, so some of those departments do pretty well, and the rest of the finance does well. Most of the organizations don't get touched, they don't feel the change, other than those 20 or so employees in those support departments, 20 or 30, whatever you have, until you start the program integration. And I agree with you, you never come in and say we're going to run everything the same. You really do live in collaboratives and get them to work together, and they'll start getting done through osmosis and time more than anything. Other questions, thoughts?
Oh, I guess I have another question. So could you talk a little bit more about IT integration?
Yes, yeah. We here's what we figured out and learned over the course of time. Okay, fiscal platforms have to integrate. it's very difficult to really keep an eye on what's going on multiple agencies across multiple geography without a fiscal platform integration. Human resources, we found, has to integrate on a data structure standpoint. I can sit down at the desk on Monday morning and tell you how many openings we have in Uniontown, Pennsylvania, okay, this morning as far as case managers go that we're short, okay? And you need to know those things because what's our biggest challenge? Our biggest challenge is competent human resource structures, training, development, and people in the field. So those things you have to have. EMRs, I won't even begin to try. Okay? We know we're gonna support 3 to 4 different electronic medical records all the time. And the reason is, even if we agreed on the best platform, we all do, okay? You know what the best ones are, the 5 or 6 that are out there that are commonplace today. But the challenge is it takes a couple of years to move an agency to a new platform. It absorbs all the energy while you're doing it, okay? So we look at the risk of moving to a new platform and realized we weren't going to do it. Instead, we basically support multiple EMRs, and then decision support in our value-based software development has been based upon being able to extract data from the same financial platform, the same HR platform in all various EMRs. And that's been a bit of a challenge technically, but our people are getting through it and seems to be working.
So, in terms of the question of, it seems to keep coming up that, we really need talent in order for this, we need it anyway, in any case, whether we're acquiring something or not. But I assume that as you're getting larger through acquisition, you're finding that you need some people who may have some skills now over a very large organization that were part of a smaller organization. And have you experienced that, or has anyone experienced that? What are the kinds of things that you do to start making those shifts, if that's the case?
I'm not sure of the question.
Does that make sense? Okay. So here you have your it's $10 million operation, and now you've run an $80 million operation. And I'm thinking that it's possible that the people that you had running a $20 million operation may not be the same people who can run an $80 million operation when it comes to things like that too. Things like that.
Yes.
Have you noticed that?
Yes. And what we have ended up doing is probably going to outside talent pools. We brought in a new CFO 2 years ago now from BKD, one of the large top 10 public accounting firms in the country from St. Louis. We hired him on as the chief financial officer. We hired a CIO out of a healthcare system in Pittsburgh. We just hired a new position called Vice President of Physician Alignment and Strategy. Okay. What we've learned sometimes when we move towards this medicalized model of care is that we keep from social service world, and that doesn't quite know how to use physicians and partner with physicians in a way that motivates and retains them. In the world when psychiatric resources are getting harder to obtain, that's critical. So we hired someone who runs a physician practice of 70 physicians to come in and really work on strategic physician alignment within our agencies overall. Because we found the ability of physicians to align, and Dave, you and I have talked a lot about this over the years, the ability to align our physicians with strategic goals is critical to being successful. If you can't do that, you're not going to keep them. Okay? And we really found that we looked for ways to do that. Those are all people we brought in from outside. And by the way, we've got a lot of smart people in our own organizations who can learn from those folks and get a different skill set. We've got several of those too who really have upped their skill sets by working with some of the newer folks that do from other businesses.
Any comment or experience with labor contracts and how that influences decision making along the way?
Just finished one. Yes, we have both union and non-union environments in our workforce. Okay? And fortunately, our VP for Human Resources is actually an attorney who has a lot of experience in labor negotiations. Okay? And it really is a strategy of figuring out how to work with those organizations in a way that meets their needs, and yet not create opportunities for expansion of those particular tools. And I think we spend a lot of time in the HR committees talking about that and working on that. So we do have both, and you work with both. And if you're going to continue with the relation, you're going to end up with it. Say, well, that's an organized organization, we don't want that one as a good facility. Good companies with good people, we found ways to work with. Any other thoughts, concerns? Okay, good go. In 1997, who's the only person in the United States who's actually won the Nobel Prize in 2 different fields in his lifetime? Anybody know? Biochemistry and nuclear proliferation. It was Dr. Linus Pauling. Okay. Dr. Pauling lectured at the age of 93. And in 1991, he was pulling into Brown University. He didn't like to fly. Quirky that way. Didn't like to be in an airplane. And Charles drove him everywhere, all over the United States for decades. And every place he went, Charles would drive him. They're pulling to Brown University on a Saturday night. And he said, well, Charles, I'm tired. He said, I don't know if I can do this. He said, Dr. Pauling, don't worry about it, I'll do it for you. He said, well, what do you mean? He said, well, I sit there every night to the same lecture. I can do it verbatim. And starts quoting the lecture and reading it off to him. And Dr. Pauling says, okay, so they walk into the students. Dr. Pauling sits down in front of him. Charles gets up and does the lecture perfectly. And at the end of the lecture, some smart-ass grad student stands up and says, Dr. Pauling, yada, 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 takes out this long equation that he wants you to solve. The chauffeur stands and looks down and says, well, you know what? Hey, man, that question is so ridiculous, even my chauffeur can answer. With that, I can introduce Kevin McField up. Thank you very much.
Clickers. Over there in the corner of the table.
Well, I don't really know where to begin after that, actually. I think I'll begin telling you a little bit about when I started my company. Oh, by the way, how are you? When I started my company 20 years ago, I spent 25 years working for nonprofit organizations. So, because I'm a finance guy, because I had sort of observed many of the things that Rick was just describing, I thought I would put out a shingle and I would start facilitating business combinations between nonprofit organizations, and that those business combinations were inevitably going to occur. And the reason they were going to occur was that nonprofit organizations fundamentally have a kind of basic structural issue. They can't issue stock, they can't issue equity. And as a consequence, they can't build balance sheets that are sufficient to enable a company to grow beyond a certain size. The revenues that a company builds over time are a consequence of the balance sheet that the company has. You can't build a company that has $1 billion in revenue if you have $40 million in net assets. There is a relationship between revenues and net assets, and a for-profit company, of course, can issue stock and keep building equity as it grows its revenues, whereas a nonprofit organization can't. So my assumption was that nonprofits were going to start combining their businesses in order to build the capital structure necessary to grow revenues, and of course, in the process of doing that, invest in the technology that is associated with building substantial companies in the modern world. That hasn't actually happened. In the first 15 years after putting out a shingle with that specific goal, I'm going to work to combine nonprofit organizations. I made exactly zero, not one penny doing that, not one penny. And instead I worked exclusively for-profit companies, because in some respects, what Rick has been describing is actually a sort of original sin, in a manner of speaking, and here's what the original sin is. Prior to 1965, social services, human services, were essentially delivered by the government or by faith-based organizations. And when that happens in a capitalist economy, it's a reflection of a market failure. A market failure is a circumstance where a very necessary public good or service is not available on the scale that's required. And it's typically not available only for one reason, and that is that the economic benefits of providing the service are not sufficient to induce private capital. And when that happens, the government has to step in. And what the government did was it passed laws that said, we're going to allow something called a nonprofit corporation. And we're going to allow them to solicit capital in the form of tax-deductible donations. And by the way, we're not going to make them pay income taxes. And the purpose of those two things was to drive capital into a place that it would not have gone otherwise, and thereby enable the creation of a system that it would at least begin to address some of the public's needs. Now, in 1965 or thereabouts, the government, of course, adopted Medicare and Medicaid and the Community Mental Health Center Act, and a lot of state laws that started driving massive amounts of money into human services. And so in a sense, what the government did was it created a marketplace where one had not existed before. But to the extent that nonprofit corporations were an adaptation to the absence of a market, it made sense at that time for, once a market was created, for nonprofits to be essentially eliminated and replaced by now for-profit companies, as happens in the rest of the economy. But instead what occurred is that they remained. And so we now have a circumstance where we have, especially, by the way, in the health insurance and acute hospital industries, it's most noticeable. We have a circumstance where we have companies that provide the exact same service as the place down the street, but some pay taxes and some do not. And increasingly, as Rick pointed out to me in a conversation before our discussion today, increasingly, in places like the city of Philadelphia, Allegheny County, etc., a very substantial portion of the real estate is exempt from real estate taxes. And of course, the nation as a whole is losing massive amounts of income tax for the reason that we have nonprofit organizations providing services that could be provided by for-profit companies. And so we kind of have an original sin here. When the marketplace changed, the business model didn't change, and it's created some interesting anomalies going forward, and maybe some, honestly, some very interesting opportunities, I think, for the people that are sitting in the room. What's that answer, man? So, the industries we work in, of course, are evolving. Only one of the factors that's causing the evolution is the presence of for-profit as well as nonprofit companies. Other ones, of course, that Rick alluded to, at-risk contracting arrangements, evolving technology requirements, turnover in provider leadership, limited capital access. The key things I think you might notice about those are essentially two. One, at-risk contracting and technology requirements both relate to capital needs, and they're very difficult to address in a nonprofit context. The other thing I'll mention is that in the for-profit world, there would be other things on this list. One of the things would be, one of the drivers of industry transformation in traditional commercial industries is that there are companies who are consolidators. They're in the business of building much larger companies. In the nonprofit world, of course, that's not really present. There is not a single national consolidator in the United States because no one's capitalized to do that. The largest companies in the nonprofit sector have 500 million in revenue or 600. In the for-profit sector, of course, it's, they measure this in billions of dollars. So in terms of outcomes from this industry transformation, you'll see more price-based competition, narrow provider networks, ultimately declining provider profits, and industry consolidation. And of course, these things require capital, and so the challenge for nonprofits that want to participate in this process is accessing sufficient capital in order to participate and to compete. Now, this circumstance, of course, creates opportunities. There's a very fragmented human service business in the United States at this point, and of course, I did a study of 1,800 nonprofit organizations. Of the 1,800, 5% had more than $50 million in revenue. So this is the very large numbers had under $5 million and $10 million in revenue. So this is a very fragmented business. Many of them are undercapitalized. There are an awful lot of people who are running organizations like this that actually look a lot like me. I sometimes am amazed. I meet with people who are older than me by 5 and 10 years who are running nonprofit organizations. Rick alluded to this next one, which is that nonprofit affiliations are almost always add net revenues. And that is a theme we'll come back to again. And the reason we'll be touching on that again is that when nonprofits combine, unlike for-profit companies, there is no purchase price. So the effect of doing a transaction is essentially to combine the balance sheets of the two companies that are coming together, not for one to buy the other. And as a consequence, affiliations on the closing date actually strengthen the balance sheets of the companies that are combining. And as a result, essentially, you can create a sort of virtuous cycle where every time you acquire a company, you keep getting more and more net assets. The more net assets you have, the greater your debt capacity. The greater the debt capacity and net assets combined, the larger you can grow your top line revenues. And Brian, the next presenter, will be, I think, talking about essentially a perfect illustration of how that has enabled his company to grow so dramatically in such a relatively short period of time. Now, because I'm a broker, unlike Ryan and Rick were chief executives, my efforts over the past 20 years have all focused on actually doing transactions. So my labors are essentially begin when a client hires me and says, we want you to find us a target company, and my work ends on the closing date. And so this is I want to talk about an illustration, kind of common type transaction that I've been involved with. My client in this particular transaction was a provider of diversified services. One of the things about nonprofits, of course, that makes this business different is that in the for-profit world, there's a desire to kind of focus on what it is that you're doing. So investors who own the shares of a company, they can invest in a company that provides IED services or behavioral health services or child welfare services, and they like companies to focus on what it is that they're doing. In the nonprofit world, of course, there's a desire for diversification so that you get revenues from multiple sources because the capital structure is different. In this instance, my client had $300 million in annual revenue and net assets at fair market value of $100 million. So you can see that we're delivering roughly they were generating about $3 of revenue for every $1 of net assets. And that's relevant because, as I mentioned before, the size of a company, there's an optimal size for all of your organizations. And the optimal size is a function of this very formula, in my opinion. You can't grow net revenues beyond a certain point if you want to be prudent. And so you need to relate the target, you might say the strategic target of your company in terms of its aspirations to what it is, to the resources that are available measured in terms of net assets. The target company for my client was much smaller. It had $35 million in revenue. It had net assets of $5 million, and it was delivering services in multiple states. Now, it was run by an entrepreneur, which I guess you could suppose from that data. But try to put yourself in this situation. The company is now generating here $7 of revenue for every dollar of net assets. So it's much more highly leveraged. It's actually operating in multiple states. This is an illustration of a company that found that it was very good at following the money. If a grant was available here or there, it would compete for them, and it was successful in achieving them, much like entrepreneurs do. But by the same token, the company had grown to a point where fundamentally, in the future, it had no real growth opportunities because it's constrained by its net assets of only $5 million. So this is the deal process. On behalf of the client, the broker, whoever it might be, would basically conduct a search to meet the client's defined needs, which are often expressed in the form of acquisition criteria. You then approach targets. But typically in this business, you would approach as many as, say, 15 companies in an effort to commence discussions with one target. And so as a consequence, this is a kind of undertaking which has very high risk and large rewards. I say large rewards because unlike commercial transactions where more often than not transactions actually destroy economic value, in nonprofit transactions, of course, that almost never happens because on the very day that the deal closes, you're combining two balance sheets, so they create wealth instantaneously. In terms of, by the way, a lot of people have, I think, questions about how to identify and approach targets. And I'll mention to you that I'm sure you're all familiar with GuideStar. One of the things that if you have an acquisition program that I think you'd want to do is subscribe to GuideStar and start developing sorts of companies that were in the geographic area, in the service area, and revenues area, that sort of thing, that are consistent with your own acquisition criteria. Additionally, because this is such a fragmented business, one of the tendencies, I think, is to waste too much time, you might say, on interpersonal efforts to try to solicit opportunities, when in fact, it seems to me a much better approach might be something that was more shotgun-like, at least initially, in an effort to unearth some expression of interest from people who may have an interest in doing the transaction that you're talking about. So, on behalf of clients of mine, I often actually present letters of intent that are unsolicited to target companies. And as you can imagine, because this is a highly personalized business, the reaction to this is not necessarily always positive. By the same token, there are 6,000 or 7,000, I think, nonprofit organizations doing this kind of work in the United States. And if instead of the approach that I just described, the alternative is to telephone or try to telephone the chief executive of each of these companies and see if you can perhaps have a conversation that might induce them to maybe having a second conversation or maybe be meeting with you. You're going to take a long time to build a substantial company because you just don't have the time or resources to be doing that. You need to get, in the shortest period of time possible, to the people who are actually interested in contemplating this possibility. And so, anyway, whatever tactic you use, that's fundamentally the issue. There's a very, very large pool of potential acquisitions, and there is a small number that are actually interested in contemplating the possibility of combining with you. If you're successful having such an expression or obtaining such an expression of interest, the next steps have to do with executing non-disclosure agreements and sharing financial information. And the reason for sharing the financial information is that if you have acquisition criteria, you want to know whether the company that you're speaking to is actually able to satisfy those criteria. If they are not, you need to move on to the next one, because that's the nature of this process. After an introductory meeting, once again consistent with the notion that you don't want to be wasting a lot of time with these things. You want to get on paper at the earliest possible time what it is that you're proposing. It's not reasonable to approach a prospective seller with nebulous notions of how things might work out and spend the next 6 or 9 or 12 months talking about a process and a negotiation and an involvement of many trustees or other parties trying to get to a closing date. The goal with these transactions is getting to closing. That's the purpose of the entire activity. So we want to get to that point, and the way to do it is to get a letter of intent before people at the earliest possible time so they can either indicate that, yes, this is what we were thinking about too, or negotiate. Maybe they don't like points 1, 3, and 5, but they're good with 2, 4, 6, and 8. Once this is done, of course, and a letter of intent is negotiated, you then get to the next stage, which is due diligence and a definitive agreement and closing. And in my experience, due diligence is usually, it's not usually likely that you'll discover that there's a deal breaker when you get to due diligence, because if there is, in most instances, these, the chief executives are experienced people. They're going to find, they're going to identify the deal breaker long before you get to that point. Now, let's see, in this transaction, my client agreed to continue the mission of the nonprofit that is becoming its new affiliate. The second thing it did was it agreed to transfer $3 million to the nonprofit. And now, keep in mind, if you're the target company, if you recall their circumstances, They had $7 of revenue for every dollar of net assets. They simply couldn't grow anymore given the resources that were available to them. So for them, for the target company, this was critical. They wanted the $3 million because if they can grow revenues at the pace of $7 of revenue for every dollar of net assets, this $3 million given to the closing enabled the company to grow by $21 million further from that point forward. And of course, once they were part of a much larger system, perhaps the $3 million, if they were successful in growing profitably, would become $5 million or $7 million or $9 million down the road. The second important thing about the cash transfer is that it's easy to confuse it with a price, but a cash transfer is not a price. A cash transfer on the consolidated financial statements of a company is merely moving the money from one of its affiliates to another affiliate. And so it doesn't constitute a price. Now think of how this contrasts with a commercial transaction. In a commercial transaction, if you bought something for $3 million, the shareholders walk away with $3 million. And from that point forward, the success or failure of your effort is related to the incremental profits that are earned by the company you acquired relative to the $3 million you invested. So if, for example, you invested $3 million, your aspiration is for the company to start making $300,000 at least from that point forward, because that would be a 10% return on the $3 million. In contrast, if a nonprofit transfers $3 million, the returns going forward from the company acquired, whatever they may be, let's say they're, $300,000. Well, when you calculate a return, of course, the numerator is how much profit did we earn, and the denominator is what did we invest. Well, when a nonprofit does this, they earn the $300,000, but what did they invest? And the answer is nothing. The return on the investment is infinity because there's no capital invested, only transferred. And so on the consolidated financial statements, there's no effect to transferring money from one company to another company. Now, the target, in exchange for this, agreed to a change of control. And typically in these kinds of transactions, they're almost always, in my experience, structured as membership transfers, and rather than mergers, both because you don't want the licensing, you don't have to relicense the business that is merged. You don't want to have to renegotiate contracts. So almost invariably, in these transactions, it seems to me, there are holding companies, and then the holding company becomes the sole member of an assortment of nonprofit organizations. So in terms of outcomes, my client won because they entered 4 new states with $35 million in additional revenue. And I want to emphasize the 4 new states is a very important thing. And the reason is that if you're trying to grow a company in multiple states, there's a big difference between having an operation in that state and building on that, or having no presence at all. If you approach a company in Maryland and you already have a Maryland affiliate, it's going to be a lot easier to get to a yes than if in fact you have no business involvements in Maryland. It just seems to be a matter of course that that's how things work. Target one because they got increased access to growth capital, and of course my client with $300 million in revenue had significantly superior information technology and financial systems relative to the $35 million company. So, how is this deal different, and how have things changed over the past 20 years? In the traditional deals going back some years, there were routinely distressed targets. There would be an extended process, and by extended I mean a year and a half, something like that. There would be no cash transfer. There would often be a CEO transition in connection with these kinds of distress situations. They would often be initiated by the CEO, who realized that 3 months from now we're going to be out of business if we don't do something. And it would routinely be in the same market. A school that was in a given city that was in financial distress would call the CEO of a school, another school in the same city, and suggest a business combination. Now, in this deal, you can see what happened was something completely different. A very healthy company, one that in fact had grown so large that it now was outstripping its capital capacity, became the target company. It took 113 days from the initial meeting until the closing date. There was a cash transfer of $3 million. The CEO, a gifted entrepreneur, like demonstrably gifted, stayed. It was initiated by a broker and something that basically didn't exist previously. And then finally got the company into multiple new state marketplaces. So, a couple things. To the extent that you're here because you might have an interest in becoming an acquirer, you might consider that traditionally, mergers and acquisitions are considered a tactic and not a strategy, and I think that that is almost invariably true, with rare exceptions that are starting now to appear. Second, this is a very fragmented marketplace, and consequently there are multiple targets. Deal execution is an organizational skill. This is something you get better at. The first time you do a transaction, you'll learn a lot, and it'll take longer. The second time, you'll get better. The third and fourth and fifth time, you'll start finding that this is a real skill. And one of the things that you might conclude about that is that if in fact you have sufficient capacity that you need to, your optimal size is significantly larger than you are now. And so to get to that size, you need to do multiple transactions. This kind of a strategy and that event makes a lot of sense for you. On the other hand, if you have an organization that has $50 million in revenue, and your capacity, based upon the present resources you have, is $70 million in revenue, well, I don't know that this is necessarily the right strategy for you. Because after you do one transaction, you're going to basically be at the point where you really can't grow much more without doing, finding some new source of capital, or I think maybe more appropriately, reversing course and becoming part of a larger entity. And I think that the real test as to whether or not you should grow through acquisition or become a seller is what your optimal size is relative to what your position is today. In the overwhelming majority of cases in a fragmented industry, the only rational answer from the perspective of the enterprise itself, which of course directors and officers have an obligation to be advancing. The only rational conclusion I think will usually be you should become part of a much larger company. Now, there are some rare exceptions to that. But again, there aren't a lot of nonprofit organizations that have 100, 200 million or something in net assets. Finally, as I tried to emphasize, I think the process in all of this should be focused on trying to target speed of execution. The notion that you want to engage in a strategy that has as a presumption that it's going to take a year and a half, 2.5, 3.5, 4.5 years to execute under circumstances of very high uncertainty, I don't think is probably rational. Now, some tactical considerations. If you're going to be pursuing an M&A strategy, board-approved acquisition criteria, it seems to me, are quite fundamental. The reason for that is that when you contact a prospective target in connection with a strategy to grow in this way, you can't be continually going back to a board of trustees to ask for guidance or approval or anything like that. We're trying to get from here to here in the shortest time possible. And as a consequence, if you have board-approved acquisition criteria, maybe you could even share with partner companies, the board presumably in connection with developing these acquisition criteria will you might say authorize a process that doesn't necessitate continually going back to them so long as the transaction satisfies the acquisition criteria. We talked about speed of execution. Brokers, that's a marketing pitch. Counsel, experienced in M&A and nonprofits, it'd be very difficult to overstate the practical significance of this. attorneys are notoriously good at killing things, and just hard. And but a good attorney really can make a difference in terms of getting deals done. And a good attorney in this context, unfortunately, is a rare person who has expertise both in nonprofit law and in mergers and acquisitions. And the problem is often that a relatively experienced board, et cetera, or executive, might be inclined to think, oh, we're trying to do mergers and acquisitions, we need a merger and acquisition attorney. And to the extent that you select somebody who's experienced doing commercial transactions, they're not only particularly useless, they're actually harmful because nonprofit transactions are not commercial transactions. They're really very significantly different, not with regard to the process of getting from here to here. They're different because of the financing is so different. And as a consequence, this notion of picking the right lawyer is very important. Now, the final thing I listed on this chart is outsourcing financial due diligence. There is, I mentioned that I didn't think there were many instances where deals actually die in due diligence because it was a problem that comes to the board before that time. But I would say that if I was a trustee, mindful that the management team of the company have day jobs. I mean, you're actually running an organization, and your CFOs presumably, well, they might be, might have auditing experience and things like that. But I mean, they have a day job, and they're trying to do all the things that they've done previously. If I was a board of trustees, I think I'd want you to outsource the due diligence to an accounting firm or something like that, or people who specialize in this. And the plus about that, keep in mind, is that it's very easy for executives in either commercial enterprises or nonprofits to kind of fall in love with the deal. Over time, you meet the CEO and you really like that person and you think the company's great. You can start imagining how this could really be a great thing, and maybe you can do. But there is this tendency to maybe start missing important red flags if you're part of the family. Whereas if you get outsourced finance experts to look at these transactions, they can come in with a kind of independent assessment for the board of trustees. And it seems to me it helps the board of trustees themselves fulfill their duty, which is, remember, if you're a trustee of a nonprofit, you have a duty of care and a duty of loyalty. The duty of care requires that you actually understand what's about to occur. And indeed, with mergers and acquisitions, board action is actually required by law. So it's very important for trustees to be able procedurally to say to anyone who asks them, why did you do this? To be able to say, we followed a certain process, it made a lot of sense, we hired outside experts, we have the attorney, we have outside due diligence, financial due diligence, etc. And one of the things, of course, you want to do here is protect the trustees who are all volunteers. So, where do you fit? I want to make these suggestions. If you have a substantial amount of capital, but you also have a substantial amount of revenue, in other words, you don't have much in the way of additional incremental growth capacity, then in that event, I think that you should affiliate. Once you have no further growth capacity, given the resources you have, I suggest to you it's time to become part of a larger entity. If you can keep building the resources, then do it. But if you can't, the notion of remaining, you might say, stagnant in a consolidating industry is almost certainly a losing strategy. The process of talking into or convincing trustees or others that this is the best course may be difficult, but the risk of trying to sustain yourself in a consolidating business that is subject in the near term to really dramatic technological changes is I think, hopeless, frankly. In the second case, if you have modest capital and modest revenues, once again, I would suggest that makes sense to affiliate. You might be able, if you have low revenues, to be able to grow somewhat. But if you have $9 million or $6 million or $4 million in net assets, the reality is that in a consolidating industry of this size, you just don't have a very bright future. Now, in the third case, if you have substantial capital, but you have, relatively speaking, modest revenues and consequently a significant amount of growth potential, in that case, I would suggest you not affiliate and you grow until you reach one of the other stages. And then finally, of course, if you have low capital and substantial revenues, that means you're highly leveraged and you're at substantial risk, and it makes some sense for you to consider affiliation on an accelerated basis if that's the case. Now, my final comment, I guess, is just something maybe pertaining to a context, and that is, we were talking about the fact that before 1965, charities were, and governments basically delivered a service for which there was no market. Now, starting in 1965, and perhaps through 2025 or thereabouts, the period we're now, there's a potentially, I think, substantial amount of industry consolidation, in part because technology is making it more and more economical to operate on a very large scale. And additionally, technology is starting to make possible aspects of a sort of personalized medicine, and therefore just create a circumstance where very large scale is going to make a lot of sense. And the final thing I mentioned is that at 2025 or thereabouts, there is a technology 5G, which you've heard about, I'm sure, that is on the horizon that I gather will change everything about living in a society. And consequently, everything that we're talking about now that's very important and very challenging is inevitably going to transform in a way that we can't even envision right now. And as a consequence, you might say, mindful that we want to have strategies that are focused on the future. I think that we have an interval here between now and the next few years where you might take steps that could change the future of the company and of the people you're trying to help, more importantly, for a very long time in the future. And that if you don't make certain decisions now, it could be that the consequences will be extremely adverse and maybe quickly so.
I'm going to comment, okay? When you I was glad to hear your closing kind of comments because, there's definitely a financial incentive for pursuing this type of endeavor. But for me, one of the things that runs through my mind is, and I come from Allegheny County where every day you're just aware of UPMC and Jeffrey Roman. And nothing happens without being wondering what they're doing. And we define ourselves as being part of the healthcare industry, and healthcare is going through massive consolidation. And so it's how do we position ourselves to be relevant to and it's not even UPMC, it's Amazon, it's Berkshire Hathaway, I mean, it's all of those, the industry, CVS, I mean, it's just changing dramatically, and it's how do we continue to be relevant within that kind of just dynamic. So I appreciated those comments. Very good. I think that it was really helpful that Kevin gave us kind of this perspective that time is of the essence, and I heard that from a number of perspectives as he was speaking. And when he brought up 5G, I know a lot of people don't know much about 5G, and it is something that we should all be reading up on because it really is very, very significant. In fact, I said to Kevin just now, we have a terrific guy who's a colleague of ours in technology. I said, I think next year we should come here and do a session on that along with this and sort of blend it in. It would be kind of interesting. I think that having gone through a lot of these acquisitions, I was fascinated by Kevin's due diligence discussion and the things that we need to sort of get the deal done. My experience has been that, and by the way, so in order to get 4 deals done in 4 years, I interviewed 54 CEOs. So he's about right with that number. It's very, very, it's very time consuming. And you can usually tell though once you've done it enough in the first meeting with that CEO whether there's an opportunity or not. It really has to do with their perspective and attitude about their organization, about themselves. So it's really an interesting process. Board education, we have a real challenge in that we have boards that in many cases are not really professional boards. So I think Kevin's comment about educating the board was really key, and it can't be skipped. You know, it takes a lot of effort to bring a board to a point where they understand enough that they really know what they're doing. And you know, for example, one thing I did was I actually brought Kevin into a board meeting and had him present on the things that he's presenting here and the benefits and all of that. And it can be extremely helpful to have somebody like that come in and talk to the board. But that's a real barrier if you have board members who really have a hard time getting on with understanding more complex things. Timing is everything when it comes to the process, as Kevin said, and I've experienced this too, that you know, I try and get through that due diligence in less than 90 days, whenever possible, because you know, we know that time fills deals, and all kinds of deals, not just acquisition deals, but any deals. So, and that takes a lot of thought too. And these are all things that take a lot of thought, because in order to get through a deal fast, you have to have the right staff. You have to have the right team on your end that can make that all happen. And one of the strategies that I've used is I don't outsource everything, because I want my team to learn. And so I engage the team in the process, in the due diligence process. However, I do outsource the finance part, some of it, not all of it actually, and outsource all of the legal. And having the right attorney there who can figure out how to get a deal done, rather than, you know, figuring out what the problems are, is really, as Kevin said, critical. So I know I'm just sort of repeating you, but, you know, sort of trying to validate some of the things you've said.
And along those lines, Imperium, we hired in-house counsel that were experts in nonprofit and governance law. And then that attorney can network and talk with the affiliates attorneys as well as the regulators as an in-house counsel member. So we have 2 in-house counsel attorneys that came from Buchanan Ingersoll Rooney here in Harrisburg that ran their governmental division. And then we also have 3 paralegals that support them, so that you have that expertise and cost cutting by having those folks in-house.
Are any of you going to talk about what should be part of due diligence? Because I've talked to a few people and they don't necessarily agree on exactly what should be included in due diligence. So
we should address some of that right here.
Yeah, so in my presentation, I actually have a supplemental schedule that's in your package that includes 13 areas. That is the beginning steps of due diligence that we've used through our deals. That's not the all-inclusive list, but it encompasses about 75% of the areas to focus on from our experience. So that's included in my slide deck as well as a handout within the package there for you.
You know what everybody forgets is compliance. We've walked away from deals because we get into compliance audits internal and look at where there might be some issues that could be very expensive in the future, and kind of point those out to the agency and suggest that they work on those first, and we'll get back to them another time. Because those are the ones you got to be really careful with, because you take on a large compliance issue and find it after you merge it, yours, you own it. And it really is challenging. So that's the area that I'm most anxious about all the time in due diligence.
Other comments so far with the presentations? Questions? Anything you'd like to share?